LSU Health Sciences Center in New Orleans to emphasize the importance of the state's investment into higher education. And as Sabrina Wilson reports, Louisiana has a need for more healthcare workers.
At the LSU Health Sciences Center in New Orleans, Governor Bel Edwards got a crash course inside a simulated operating room.
The tip of the tube, you're going to see it in your camera here.
State investment in higher education is the reason Edwards stopped here, and dozens of healthcare professionals and medical students showed up in the same spot.
You invest in what you prioritize.
Louisiana is currently flush with cash, but when Edwards took office nearly 8 years ago, the state had a $2 billion deficit.
We have actually increased state higher education funding per student by 34% since fiscal year 17, and it puts us ahead of the pack. If you look at nationally.
State money that helps LSU Health New Orleans.
We provide the majority of the physicians for the state, dentists for the state. Our nursing school is ranked in the top 10 in the United States. And so we provide most of the healthcare professionals that are going to take care of you and me.
Dr. Steve Nelson is LSU Health New Orleans interim chancellor.
So this fiscal year, the Health Science Center received over $110 million. And many of those dollars would go to rehabilitating facilities that were over 30 to 40 years old. I had funded, NIH-funded researchers that were in laboratories where their roof was leaking and they had tarps collecting the water to run into their sinks.
While Edwards thanked the healthcare professionals for their work, more of them are needed.
And there are 95,000 job openings in Louisiana for healthcare professionals. There are similar stories across the country, and so there's tremendous demand for healthcare professionals.
Of course, getting a medical education is not cheap, but here at LSU Health New Orleans, Dr. Nelson says they do what they can to help students.
And some of the programs we're trying to deal with that, we have support for what we call the Rural Track Program, so that if you commit to practicing in rural Louisiana in a primary care specialty, we'll give you 4 years of free tuition. And again, so that lifts the debt out from that individual so they can practice the sort of medicine that they want to do. Similarly, we're going to start that program in dental.
Healthcare professionals also applauded the governor for expanding Medicaid in Louisiana to help the working poor. Lee.
All right, Sabrina.